First of all, I'd just like to say that I did a presentation 6 years ago on the Gold Coast. So that's had 28K views, which I don't suppose is too bad. But I'm probably a little disappointed in the progress over that time in terms of the uptake of low-carb nutrition, particularly in gastroenterology. People are very bound to convention, very bound to guidelines, and I think that's possibly part of the problem. There's a lot of science in that talk because I sort of thought that we needed to present the science to convince people to do it, and it's still relevant today. But I was going to talk a little bit about the failure of uptake really today, because I think that needs to be addressed. So the conclusions I had from 2019 was that there was sufficient evidence to use it first-line treatment for fatty liver disease, or obviously diabetes as well at that time. But I had found very good responses for things like irritable bowel and reflux, for which there is evidence, but it's all small, and trying to do a randomised controlled trial of those things is very difficult. And as everyone would know, doing randomised controlled trials of diet is impossible. Randomised controlled trials are for drugs. They're not for this type of intervention. And people need to use their experience with patients to actually guide them to some extent. So my view is that most of my patients are coming because of insulin resistance. There's obviously a few other things scattered through, but I would say that 90% of the work is tied up with insulin resistance. So I used to do a lot of ERCP, and the people with pancreatic cancer, they were virtually all insulin resistant. It was difficult to capture them, treating them post-diagnosis, because they ended up in surgical pathways, so you really couldn't follow them up to any great extent. And similar for bowel cancer, they end up in surgical pathways, so you don't really get to influence their treatment that much. But virtually every patient with pancreatic cancer and bowel cancer, in my experience, has insulin resistance, and I do think it's a critical factor in that. So they were the conclusions from 2019. They still hold. They're stronger. The evidence is stronger. So I guess I need to present my conflicts of interest. What I say is based on the best available evidence that I can find, but a large component is clinical experience. I've been on the Sunshine Coast since 1990 and using low-carb diets for 10 years, and I really have seen amazing real-world results. People's liver tests will normalise usually within 6 weeks if they do low-carb properly. Not everyone will do it, which I'm sure is something that everyone here experiences. And the other side of it is a fairly large pro-livestock bias. So I've got a fairly major interest in that these days. Possibly Lancet promoted that. And I think it's important to realise that ultimately we are all solid powered. Where does our energy come from? It comes from breaking down food, which releases CO2 and water and energy, and that's where our energy comes from. Plants use the energy from the sun to produce sugar. Then you've got this amazing digestion in ruminants that takes that sugar, turns it into fat, and in the process you do release CO2, but you're releasing the CO2 that was fixed with energy from the sun. And it's somewhat anecdotal, but I think people not eating much fat probably have higher emissions, and it's proven by testing their RQ. So we do this. I can't say I'm using it a lot, but someone on a full ketogenic diet will have an RQ of 0.7, which means they produce 0.7 CO2 for every oxygen they consume, so they're actually emitting less CO2. Whereas if you're burning sugar purely, your RQ is 1. So this is a way you can actually assess whether someone is actually ketogenic or not, because in the morning they should be burning fat. If they haven't eaten overnight, they should be burning fat, which is why their triglycerides in their bloodstream are low. If you've got high triglycerides in the morning, you have not been burning fat. And often this is why I think it affects sleep, is that people run out of sugar. So their sleep is disturbed because they've run out of energy. Whereas if you can burn fat, then your energy is maintained overnight. And in the morning, your triglycerides are low because you've been burning it all night. So, from a clinical perspective, high triglycerides are the thing that points to metabolic dysfunction in someone. So, yes, cows do release more CO2 when they make fat, but then we release less. So there's conservation of matter. So there's no extra CO2 from animal agriculture. It's just emitted in slightly different ways. And in reality, ruminant agriculture leads to more carbon in the soil. So we're actually sequestering carbon in a net way. But we are all powered by the sun. And in fact, there's very good evidence that infrared can power our mitochondria. So this anti-sun sort of rhetoric is harming people. LED lights have no infrared, so there's evidence that if you shine infrared on someone's back, their blood sugar drops. So it's actually powering us as well. So we're partially powered from the sun as well. So I think a lot of the conventional thought is absolutely wrong. And this has probably prompted me in 2019 to get into animal agriculture. You've probably heard of Eat Lancet. That's the amount of meat they're recommending per day that people eat. And that amount of meat is associated with child growth stunting in the countries that cannot afford to eat meat, and like IQ, school performance, all of that stuff in those third world countries improves with increased meat intake. So the whole Eat Lancet diet for planetary health is at the expense of human health. And I think it's based on this CO2 premise, which is actually wrong. So that's why I'm sort of been into farming, I guess, since 2019. So I've been using the diets for a decade. It's default diet for fatty liver, which is 30% of the adult population. It certainly works for reflux, which is an early sign of metabolic dysfunction. The same with irritable bowel. I found it to be an adjunct in colitis, ulcerative colitis and Crohn's. I'd never actually had anyone go into full remission, but their control became better. But there's lots of people who've discovered the carnivore diet for themselves, and they travel to see me just so they've got someone who doesn't criticise them for doing it. And I have seen remissions, often in people who you wouldn't think would be that radical, but they just go, that's the only way I can fix the problem. And they're sort of everyday public servants and people like that who found that the carnivore diet fixes their problem where we can't. The medication doesn't work. I also use my low-carb handouts for celiacs because there's so much processed food for celiac around today, which is full of sugar, rice starch, all these other things which are very high carb. So really, if you've got celiac, low carb is ideal. You just have to be strict, very strict on the flour, sort of gluten side of the equation, but that should be the default diet. And also I've had quite good success with low fibre or zero fibre diets for constipation, particularly the severe once every 3 weeks bloated pain, often young females. They're very grateful usually that by cutting out the fibre, they're actually a lot better. Having said that, there's some people on low carb get constipated. I think salt, magnesium, adequate fat is the mainstay, but for some people, taking a bit of fibre seems to work, so I'm not against that. So I don't really have any obesity practice. I'm trying to treat people with gastro conditions. Incidentally, I've reversed lots of diabetes just as a side, trying to treat their other problems. And often that's just with a handout. Most symptomatic patients that come through, we do waist-height ratio on everyone. They almost all have central obesity. It's the screening for bowel cancer people that have normal waist-height ratios, and usually there's nothing really wrong with them. Probably I was very into this. I was considering trying to do a fatty liver trial, but really it wouldn't have a control. No one would take any notice of it, I don't think. And then I've been heavily distracted by COVID matters since 2020. And it's interesting that bad outcomes from COVID were all tied up with metabolic dysfunction. Your blood sugar on admission was the best predictor of mortality. The higher the blood sugar, the more the mortality. Your vitamin D levels, and vitamin D is a marker of metabolic dysfunction. So I think the low-carb metabolic health is important for viral infections. So I've been involved in small-scale beef and dairy farms since 2019, since prior to that. So the real question is, why has so little changed? This was a study that was available in my last presentation, and it's not a large randomised controlled trial, which I don't think can be done with diet. It's 10 patients, all with significant fatty liver, who were treated for 2 weeks with less than 30 grams a day carbohydrate. And they tried to stop them losing weight. They didn't totally succeed. They tended to lose a kilo or something, but their liver fat dropped by 50% or 43% or something in 2 weeks. And the other side of it is they actually changed their microbiome as well. That's a bit of a summary of the findings. So the folate producing bacteria in the gut increased, and there's some of the fat metabolism in the liver is folate dependent. So they're burning their liver fat and they're not creating fat from sugar. So a 50% reduction in 2 weeks is amazing. And that's consistent with people's liver tests go back to normal in 6 weeks. It's a very rapid thing. There's a lot of talk of microbiome. I think the microbiome is heavily diet dependent. So they studied the microbiome and people's bacteria changed. They produced folate, they burnt fat in their liver, and things got better. Now, this was a 2-week trial. They went back to their normal diet. They studied them, 5 months later, and their liver fat's all back, basically. So it is something you do need to continue. This, to me, what are the odds of 10 patients all having an identical response? It's ridiculously high. This is really proof that a ketogenic diet fixes fatty liver. So I don't think we need to take it any further, but people like to do intention to treat trials where you tell a large group of patients to do something and you don't worry whether they did it or not. And then 6 months later you say there was no difference in outcome. So people do need to do it. If you don't do it, it doesn't work, quite surprisingly. So there is good evidence that low-carb diets have much better results at reducing liver fat. And there are heaps and heaps of patients with a normal BMI who have fatty liver. They generally have central obesity. So those people, it's not weight loss, it's the change in diet that is making the difference. And, this study showed, and there's others, showed much better liver fat loss with the same weight loss. So following that, leading up to this conference, I saw an email for this education session run by gastro professors, GP college, and people have to do CPD, so they're always looking to attend something to get some points. So I thought I should attend this. It's an online Zoom thing. The critical slide in the presentation, which absolutely horrified me, was them saying weight loss is more important than diet type. No macronutrient ratio makes any difference. They're recommending the Mediterranean diet, and I guess people are now aware of how little nutrition education doctors get, but it's appallingly low. And people keep deferring. The cardiologists say Mediterranean diet's better for heart risk, so we'll do that. And the reviews of fatty liver all say the same thing. We'll prescribe a heart-healthy diet, and it's all about weight loss. So they do mention fructose and trans fats, which were in vegetable oils, generally been taken out. They do say coffee's good, which I like. So this was their diet summary. So they're recommending plant-based diets, minimal animal protein. They're mentioning the blue zones, and I'm sure there's lots of low-carb presentations on the issues with the blue zone data. There's a lot of confounding factors, and really it's in no way controlled. So this is the advice your GP is getting currently. When I was watching the presentation, they had a section where you could ask a question. And I said, well, there is very good evidence that low-carb ketogenic diets had shown much better liver fat reduction. And they responded to me that I think they actually said you might be right, but it needs medical supervision. It's potentially dangerous and there's no long-term data. There's no long-term data for our safe and effective low-fat diet either. So, it's like you introduce something without data, then you demand all this data to actually do something different. Interestingly, my Zoom session crashed. So I don't think that was on purpose, but so I rejoined on my phone and I could see everyone else's question, but mine wasn't there. So it had been blocked. So people don't want the low carb message to get through. It's, that was interesting. And on AusDoc, which is a GP rag online, I've been commenting on low carb, vaccine, ivermectin, all sorts of stuff for years. Very careful to make it, evidence-based. So all of a sudden, my comment section on AusDoc has been removed. So I can read it, but I can't make any comments anymore. So the message and information is being filtered, and the message is treat to target. So they talk about all the other associated conditions which other people are talking about. I've talked about in my first talk, the hypertension, the diabetes, all of the other associated conditions, but they're basically just saying there's an association, where I think most people here would think they are the same condition. They're insulin resistance, and generally all of them will respond to improving metabolic health. But they're heavily pushing treating to target, which I think was presented yesterday, these incredibly low cholesterol levels, blood pressure control, diabetic medication. So this is an absolute boon for the pharmaceutical industry. People end up on multiple drugs, all treating symptoms of the same condition without acknowledging the underlying cause. So the other thing they presented was very promising data on semaglutide and a couple of other very expensive drugs that haven't been approved in Australia yet. So there's a green tick for semaglutide for every aspect of this, which is probably true. It does have beneficial effects, but it also has a lot of risks. And you're not actually treating the underlying condition. Basically GLP-1 is released by food getting into your ileum, the distal small bowel. So that is unprocessed food, whereas all the processed food is gone in your jejunum and there's nothing left in your ileum. which is probably one of the ways that the gastric bypass surgery works, is you're directing food straight into, it gets into your ileum much quicker, so it will stimulate your GLP-1. So I think it's $500 a month or something for semaglutide. Multiply that by 30% of the adult population, and that's a fairly big cost. It's, to my mind, it's rent-seeking. Even if it's on the PBS, we pay tax. So this is a huge financial boon to drug companies. So I have a problem with consensus medicine. It ends up the worst of all worlds in my mind. In this recent guideline released by my society, the Jesus Society, diet, I searched it, diet's mentioned twice, and it's just diet and lifestyle. That's about all they say. So it's all about drugs. So there is alternatives, but I mean, one of the problems, the editors of, this is the Lancet, but the BMJ, New England Journal, the ex-editors have all said at least 50% of what you read in the journals is false. It's not reproducible, it's corrupt. Their income stream is preprints that are bought by drug companies. So they're in the business of making money out of satisfying drug companies. And it's this multi-centre, placebo-controlled, randomised controlled trial is the new standard of evidence rather than clinical acumen. And this is John Ioannidis, who's been mentioned, and is saying most published results are false. So we've got ourselves in a fairly tricky position. So, I mean, I got annoyed with drug reps in the 90s and stopped seeing them. I mean, I think even like Nexium, it was approved and it's an isomer of omeprazole. It's like, how can you get another 10 years patent? I mean, people are propping up the profits of drug companies. I knew nothing about nutrition either, to be honest, until my daughter told me that sugar was a drug. And I told her, don't be ridiculous, it's just empty calories, which is what I was taught. And so that's how I discovered low carb. I just started doing some reading, and all of a sudden it's like, can this be true? So, 6 months of intense reading, sort of like COVID really. And all of a sudden you realise, wow. And so I started using on patients, but I felt like I needed to know enough to defend myself from people like APRA. So, and I've held a lot of unacceptable views since 2020 as well, and spent 11 months on the farm when I couldn't work. So also I've been reading around at what's going on. I'd really recommend this book or watching some of his videos. He's a neuroscientist, psychologist, psychiatrist who's really explored two ways of thinking, left and right brain, and he basically says everything that was said about that in the past is complete rubbish. And he queries whether it's going to be the unmaking of the Western world, which a lot of people are worried about. So what has happened, we've fallen into this left brain thinking. Left brain is to get food. It's like apprehend things, grab stuff. But if you're too focused on that, somebody eats you while you're doing it. So your right brain is always scanning the environment, looking for danger, trying to appreciate things from a more holistic point of view rather than just getting stuff. The left brain uses simple models. A lot of it's speech, and a lot of people would know that speech is a fairly inadequate way of expressing things. It's only a rough approximation. So it's very like AI. AI is based on reading lots of text and coming up with an answer. And if more people write lots of text about low-fat diets, it will recommend low-fat diets. That's the bottom line. It's very mechanistic, simplified with rigid rules, encourages bureaucracy. It's quite narcissistic, and people get very angry when you violate their beliefs, which I'm sure many of us have experienced. And they reject experience for people to say, look, I've treated so many patients and this works, that doesn't. And I mean, I think being a conventional dietitian must be the most depressing job in the world because, like I used to send people to the dietitian, but it's like it's wasted time, but I've done it, because it virtually never worked. So whereas low carb, there's lots of people can't stay on it and all that sort of thing, but it does work in a different way, and I'm sure it's much more satisfying. It's certainly much more satisfying to me, and I'm sure we have a low carb dietitian on the coast who is the daughter of my practice manager who did the same thing, went through the whole dietetics course, answering the questions the way she had to pass, but now practices low carb medicine. So she's a great resource. So in terms of bureaucracy, I guess this is just correlation, so it doesn't mean much. Has healthcare become more bureaucratic? I think so. So if you want to explore it, he's released another 2 books, The Matter with Things, which do very deep dive. They're very hard reading, but they're interesting because he's trying to present all the evidence of what he's saying is true. So I think it's worthwhile doing that to understand what's going on. So as everyone at this conference will tell you, that processed food is the big problem. It's a major multi-trillion-dollar profit area, whereas in the past people bought from local farms, grew their own food, had some chickens. They were actually much more self-sufficient. And the thing is that to have a low-fat diet, it requires processing of the food to get rid of the fat, and it's generally replaced with sugar. So this low-fat diet thing is probably the root cause of a lot of the problems. It introduces all the vegetable oil as well. So low-carb diets exclude most processed food. The other side of things, which I think has been presented at these meetings, is sunlight exposure. I think a lot of people suffer from avoiding the sun in a ridiculous way, and it can power you. It generates vitamin D. It's emerging as a significant thing, and even with LED lights, they remove the infrared element. So it's not good for people. So I advise avoidance of vegetable oils. There's no doubt that you can fix diabetes while not avoiding vegetable oils. That's been proven by the CSIRO. And there's a fight between carbs and vegetable oil. My feeling from intuition is the vegetable oils start the process and take 20 years to actually damage your metabolism. You can mostly fix that by avoiding carbs, and there's a half-life of 400 days for vegetable oil, so it would take 5 years to get them down. And a 5-year trial to see whether people's metabolism gets better is a very difficult, expensive thing. It's hard to avoid if you go out and eat somewhere. So vegetable oil was invented in the 1880s. Their consumption has gone up enormously. So I think they're a cofactor in the whole process. So just to give you an example, I think it's like 60 or 70% of US calories come from vegetable oils in the current day and age. So this has been presented by other people. Virta Health has really shown this amazing, reversal of diabetes in large numbers of people, and it's been maintained. The people involved have shown previously the lipid changes which other people have gone through, and I think the LDL sometimes goes up a bit, but in the overall scheme of things, the risk factors go down. And this is, I quite often show this to patients, if you've got a very good HDL, then your LDL cholesterol hardly matters at all. So triglyceride HDL ratio is a good predictor of risk, and there's no benefit of statins in someone with a good triglyceride HDL ratio or a negative CAC. So I have a tendency to try and take people off statins when it looks safe to do so. So just to work on the experience side of things rather than the evidence-based sort of what have I learned. I talk to every patient about their diet, whether they're having a procedure or not. And whenever they say, I eat a healthy diet, that's total red flag. They're high compliance patients. They're trying to do the best for themselves and their family, but they are shooting themselves in the foot continually because they know it too. So they're quite difficult patients to convince to change because they know what's healthy and what you're telling them is not healthy. So a lot of people still think that eggs are dangerous, even though the powers that be have withdrawn that. So people swap chicken for red meat because it's healthy, which is complete garbage. There's very little iron in it. They're all fed omega-6 sort of grains, so the content of the meat is nowhere near as good. I mean, the ruminants have a superpower of turning completely undigestible to humans grass into everything. Vitamin D, B12, vitamin C, they can do it all. Does require you to graze most of the day, but it's a superpower. So the other point is particularly young women may not be overweight, and PCOS, they're insulin resistant, they've got irritable bowel, they may have reflux. So they don't need to be hugely overweight. So you need to look for that in young women, and it's rampant. So, and I quite often, prick my ears up when I hear PCOS or gestational diabetes, because these are a group of people who are highly sensitive to Western diet. They're going to have a pretty awful life if they don't do something about it generally. So does diet compliance fade? Of course it does. People come back. People don't take notice. But the people who've done it well just go, I know what to do. I know it works. I'll get back on the horse. That is quite different to I give up. I can't go hungry all day. I've tried. I'm not eating much. It doesn't work. They're sort of like, okay, I need to get back on it. And that's quite a different experience, I think, I'm not going back to the dietitian. She was hopeless. She said, I'm doing all the right things, but I must be eating too much. That's sort of the answer generally. And the other thing is that a life without bread is, I think, essential. Once you start bargaining for people for how many slices of bread and low carb this, it sort of falls off the cliff, I think. I do bargain with people on alcohol. I say it's carbs. So if you want to have a couple of drinks a day, you need to make sure you are eating well, keep your carbs low and swap it for alcohol. So, because telling people not to drink any alcohol is sometimes quite fruitless. So I think the underlying issues are guideline-based medicine, consensus guidelines, suppression of alternative views, and really our regulators have said we have to preserve support in public health. But I can't support public health. There's so many things they say I think are actually wrong. And the pharma takeover is treat everything to target, treat multiple drugs, no root cause analysis. And I don't think the government should be in the business of health promotion. It's like consensus of bureaucrats come to something and they'll never change. And I think the left brain thinking is part of it. A little bit of light, and I think Gary Fettke alerted me to this. There's now a low carb or TCR thing in the diabetic treatment. So if you're a GP, you're following the guidelines if you use low carb for diabetics. So that's a huge development. They're very iffy in their language and very reserved, and the RACGP apparently has one line in the whole diabetes blurb, I couldn't find it, about this, but it is there. So if you're worried about regulatory oversight, it's there. So you're safe. And I think, people like Gary Fettke have paved the way and beaten the regulators. So we've got a guideline, you're safe to do it. And, people need to actually apply this science, get their own experience, get some insight, and your oath is to the patients, not to public health. And you've got to read stuff yourself, including journal articles. There's heaps of lectures online, and we need the ability to debate the science. So public health needs to get out of this space, or the regulator needs to get out of this space. Patient handouts are great. I've got a few that I probably give to 90% of the patients. And people come back for a follow-up colonoscopy 3 years ago saying, thanks, I reversed my diabetes. That was the entire intervention. Here, have a read of this, do this. And some people can just do it with no other intervention. I mean, support would be good. We need to support small farmers to get food that's not contaminated and not fed Boviar or given mRNA and things like that. But so I think we need to move back to smaller, more self-managed food. Get some chickens. It's like anything in the fridge that's out of date goes to the chickens. So they love it. So it's, I think, and you get much better eggs with much better omega-3. Feed them a bit of meat, they love that. So, and don't trust AI. I mean, you can make AI trustable by feeding it the right things, but it's really it's a very good text wizard. It will give you great summaries of text, but it all depends on what it's fed. It's a great wordsmith, but it can't think, and you've got to work out what's real and what's not. And I have a read of some of the Ian McGilchrist stuff. I think it's very good. Try and get some articles in the press. So we have tried. Cara, who's in the audience, we used AI to write it. It's a very good wordsmith to help us write it based on a previous talk I did in The Spectator, which is probably not widely circulated, but sometimes when people see something in the press, God knows why they still think that, but some people do, that it's real. So we've had some articles there. And I mean, in conclusion, science is the belief in the ignorance of experts, and it's been turned into I am the science. And we need to challenge it. We need to look for ourselves, actually get our own understanding and not just be fed guidelines, because if doctors are fed guidelines and won't go out of them, we'll be replaced by AI within 5 years, I reckon, because that AI would be very good at following guidelines, and then you'll never get another opinion. So anyway, there's lots of slaying of beautiful hypotheses around, but that's what we need to do. So anyway, that's where we're at the moment. So it's very satisfying to practice, I think. Much more, I would think dietitians that practice low-carb nutrition are very happy with their work. And I think ones who are sticking to the guidelines are probably bored out of their brains and despondent, really, because it just doesn't work, basically, calorie control. Anyway, I'll conclude there. So thanks, everyone. Thank you.